So moving on to the next title, which is clinical features of sepsis. So let us try to answer this question. What could be the potential clinical presentation of sepsis? Is it apnea? Is it hyperglycemia? Is it hyperbilirubinemia? The answer for this is all of the above. So a sepsis is a great mimicker. They can present with anything and everything. So we have to be very vigilant whenever we are dealing with a newborn baby. So what is the manifestation from cardiorespiratory aspect? They can present with apnea, tachycardia and hypotension. From a metabolic perspective, there can be hyper or hypoglycemia. And from a temperature instability, there can be hyper or hypothermia. And from perspective of skin, they can show reduced perfusion, they can show mottled skin, the skin can look very pale and there can be jaundice as well. In terms of behavior, the child can manifest with lethargy and poor feeding. So, as I told, sepsis is a very great mimicker. It can be anything and everything in newborn, can be a potential manifestation of neonatal sepsis. So, what are we discerning from this particular clinical picture? So, you can see the mottling of the skin and there is a net lacing kind of picture which indicates that the baby is having reduced perfusion. So, this can be a very well a sepsis feature. So, other clinical features can be depending on which organs are involved. Once there is a bacterial sepsis, bacteremia, it can either go and manifest as meningitis or ventriculitis. It can manifest as urinary tract infection when the lower urinary tract or upper urinary tract is affected. There can be umbilical sepsis or sometimes there can be septic arthritis or osteomyelitis. So, depending on what is the which organ system is affected, the clinical manifestation also varies. Say for example, if it is meningitis, they can present with lethargy, poor feeding, irritability, hyper and hypertonia, seizures and rapid increase in head size. Whereas if it is an UTI, there could be vomiting, failure to gain adequate weight. If it is an umbilical sepsis, there can be copious pus discharge from the umbilicus. If it is septic arthritis, the baby will not be moving the limb due to pain. So, it can present with pseudoparalysis.